Welcome to today's presentation on respiratory support strategies in the intensive care unit, ICU. In this session, we will focus on the various respiratory support measures implemented in the ICU setting, including mechanical ventilation, non-invasive ventilation, high-flow nasal cannula, and prone positioning. Let's explore these interventions in detail. Mechanical ventilation is a critical intervention used in the ICU to provide respiratory support for patients who are unable to breathe adequately on their own. It involves the use of a ventilator, which delivers controlled amounts of oxygen and helps remove carbon dioxide from the patient's lungs. Mechanical ventilation can be invasive, with an endotracheal tube inserted into the patient's airway, or non-invasive, using interfaces such as masks or nasal prongs. Indications for mechanical ventilation include acute respiratory failure, exacerbation of chronic respiratory conditions, severe pneumonia, acute respiratory distress syndrome, ARDS, and postoperative care. The decision to initiate mechanical ventilation is based on a thorough assessment of the patient's respiratory status, oxygenation, and overall clinical condition. Mechanical ventilation offers different modes, each tailored to the patient's specific needs. Common modes include assist control ventilation, synchronized intermittent mandatory ventilation, pressure support ventilation, and continuous positive airway pressure. The choice of mode depends on factors such as the patient's underlying pathology, respiratory drive, and the desired level of ventilatory support. Non-invasive ventilation, NIV, provides respiratory support without the need for invasive intubation. It involves delivering positive pressure ventilation through a mask or nasal prongs. NIV is particularly useful in conditions such as acute exacerbations of chronic obstructive pulmonary disease, COPD, and cardiogenic pulmonary edema. It helps improve oxygenation, reduce work of breathing, and avoid complications associated with invasive mechanical ventilation. High-flow nasal cannula, HFNC, therapy delivers a high flow of heated and humidified oxygen through nasal prongs. It provides a comfortable and well-tolerated method of respiratory support. HFNC is beneficial in patients with hypoxemic respiratory failure, as it improves oxygenation, reduces work of breathing, and helps maintain airway patency. It is also effective in reducing the need for invasive ventilation in certain cases. Prone positioning involves placing the patient in a face-down position to optimize oxygenation and ventilation. It is particularly beneficial in patients with moderate to severe ARDS. Prone positioning helps improve lung recruitment, redistributes ventilation, and reduces the risk of ventilator-associated lung injury. This strategy has shown improved outcomes and reduced mortality in patients with severe respiratory failure. Optimizing respiratory support in the ICU involves several strategies. Adequate sedation and analgesia are necessary for patients on mechanical ventilation to enhance comfort and tolerance. Lung protective ventilation techniques, such as using low tidal volumes and minimizing barotrauma, help protect the lungs from further injury. Weaning protocols should be implemented to systematically liberate patients from mechanical ventilation. Collaborative care among healthcare professionals, including respiratory therapists, nurses, and physicians, is crucial for providing comprehensive respiratory support. In conclusion, respiratory support plays a crucial role in the management of critically ill patients in the ICU. Mechanical ventilation, non-invasive ventilation, high-flow nasal cannula, and prone positioning are essential interventions utilized to optimize oxygenation and ventilation. By employing appropriate strategies and tailoring interventions to individual patient needs, we can enhance respiratory function and improve outcomes in the ICU. Thank you for your attention. We hope this overview of respiratory support measures in the ICU has provided you with valuable insights into the management of critically ill patients.